Now, you've been in the hospital quite a bit. What would you say some of the biggest barriers that you've seen insurance cause for that individualized care?
Yeah, a lot of times you need the proper diagnosis codes to even be allowed to do anything. Order different images, order labs, and then if you don't have the right diagnosis codes, it ends up either being rejected or not covered. Prior authorizations, like if you have chronic knee pain and you want to get an MRI of that knee, really figure out what's going on. A lot of times they make you do physical therapy first instead of just getting to the answer right away. And then I think that within the hospital, especially different consults for different specialties, every time you consult a new specialist or the primary care team for something easy, that's driving up the cost for the patient. And they're not really even recognizing that that's a thing. So we're driving up the cost for our patients. They're ending up with the bill. The insurance looks like they're covering a huge portion of it because the price has been marked up so high. But in reality, like you just mentioned with the x-rays, I went in for an x-ray of my ankle one time, $250 for an x-ray with insurance. And I'm like, all right, I'm going to use cash. And they're like, okay,
Yep.
cool.
$70. Yeah. It's crazy. It's just
Yep.
absolutely nuts. But this isn't something that we're told, right? We're told from the get-go, like, hey, you have health insurance. Anytime you get sick, injured, this is what you use. No one's ever told us, hey, there are other options. And I mean, not only does it save you money, but, let's not forget the fact that when you go to your traditional insurance-based primary care clinic, these are 10, 15-minute appointments. If you're lucky, what can you really flesh out in 10, 15-minute appointments? When you're going to a DPC practice, what are your average times?
We usually aim for about an hour, especially with an intake appointment. We really want to get to know our patients, what's driving their health. I read a whole book on just being a happier person makes you healthier, mainly because you're not leaning into junk food and unhealthy habits to kind of cope with that. So really diving into their mental health and seeing what's causing them anxiety, what's stressing them out, how can we address that? And then just really listening to them and seeing what their lifestyle looks like. Everyone's life is different. If you take a 25-year-old with no kids, it's going to be easier than, a 35-year-old with 4 kids.
No, yeah, sure.
So big variances there, but I think in the insurance model, everyone gets treated very similar because they don't have that time to form a relationship with their provider. They don't have time to give you the preferences that they want their healthcare to look like. And that's something that we love to dive into with all of our patients and really listen to them and see what they want to do. If they want to lean into lifestyle changes or if they just want a medication, we're here to support you either way.